Hi, everybody, and thank you for joining us today. We have Dr. Megha Rao with us, and she's from University of Washington. We are happy to have you with us too, Dr. Megha, and you can start away.
Okay, thank you so much, Asta. And thank you, Dental Student Society. This has been such a great opportunity. I'm really happy to be here. Okay, hi everyone. My name is Megha Rao. I am a D3 IDDS student at the University of Washington School of Dentistry. A little bit about me. I am from the city Bangalore in India. It's a city in South India, and I grew up there all my life. I'm a cosmetic dentist and endodontist, and I did private practice for 3 years while I was studying at Muka Facial Surgery. This is a practice that was started by my father, who is an oral surgeon, and he still runs it in Bangalore. Three fun facts about me that are non-dentistry related. I love yoga. So I grew up as a gymnast, did gymnastics all my life. Once I got into dental school, I started developing a lot of neck and back pain. And that's when my journey in yoga started. It started off as something to help with the pain, but then it became a newfound passion for me. I also come from a family of musicians, like everyone plays an instrument or sings. So both my husband and I also sing. And I do a lot of photography. And over the past 3 to 4 years, I have transitioned into dental photography, and that's been a fun journey. So that's about me. I finished my BDS in 2018 from GDC Bangalore. And I believe that this really created a very strong foundation for me in terms of my dental education. I went on to pursue my master's in conservative dentistry and endodontics from RV Dental College, graduated in 22, and I moved to the States to join my husband in 22. And that's when my DDS journey began. I got into the University of Washington in 2023, and I started school early this year. And it's been a very nice, long 11-month journey so far. So this is my timeline in terms of my DDS journey. When I moved to the US, it was in August of 22. And back then, my husband was doing his MBA program at the University of Washington Foster School of Business. And he had an internship that he was doing in San Francisco for 2 months. I moved to San Francisco. I was there for, I think, 3 or 4 weeks. So when I moved, I thought I'll make the most of my opportunity. And I started by doing an observership in UCSF. I was really happy with the experience. So I asked them how I can continue to be with them even after moving to Seattle. And they said that they had an opportunity for a virtual preceptorship back then. So that's what I enrolled into. And I moved to Seattle in September of 22. And I continued to do that for a few months after. After moving to Seattle, I started preparing for my INBDE. For me personally, I found that I had a lot to study for the INBDE, and I definitely needed to prepare for it. So I gave myself that time. Simultaneously, I started dental assisting in two practices. I was lucky enough to find a dentist who lived just down my street. So he was an oral surgeon. He had two practices, so I used to go and assist in both the practices. And that was my introduction to the US healthcare system primarily. In December, I passed my INBDE, and in Jan, I gave my TOEFL exam. During this time, I was also simultaneously working on putting together my CV and also working on my statement of purpose. And that's when I started looking at, bench prep courses, trying to see what's out there and how much those courses cost. And in Feb, I found that Duggan was having a bench prep course, and this course happened to be a lot cheaper than what it was going to be in March and June. So I jumped into the opportunity. And till date, I think this is one of the best decisions I've made because this course really helped me understand what dental schools are looking for here in the US. Um, and it kind of helped me paint a picture of what my prep should finally look like at the end of everything. So I started practicing, doing all practicing on, typhoid on teeth and all of that, starting in Feb after I finished that course. During that time, I also started assisting in another dental practice. I met this wonderful mentor in Seattle who used to allow me to practice in his clinic itself when there were no patients and over the weekends. And he used to also look at my preps and give me corrections. So that really made a difference to me. In March, cap cycle opened and I began, putting things together. And by the end of March, I had put in a couple of applications to a few schools, University of Washington being one of them. In June, I was lucky enough to receive a call for an interview at UW, and that was one of the best emails I've received. And I gave my bench. For those who don't know, at UW is pretty hard. It's a 2-day bench course, and I think it's considered one of the hardest in the country. But the very fact that I'd started preparing for it from Feb, I would say really helped me, develop my hand skills and stuff. And I still remember going in there thinking, I'm going to give it my best, and the rest is up to them. If they think I'm good enough, then I'll get that admit. If I'm not, maybe I have room for improvement. So I went with that attitude. And I think it worked in my favor because I did receive an offer of admission from UW in August. So that was my journey from August to August. After I moved here, got in a year later. Yeah, so that was my first cycle, and it was also within a year of moving to the US. In December, we had our orientation program for the IDDS program, and in Jan of this year is when I started school. So a little bit about my profile. Of course, this is not everything, but I've just put a couple of points that I think will be useful to fellow applicants. I had a GPA of 4.0, and I started writing my statement of purpose very early on. I took a lot of pride and a lot of enthusiasm in writing it because I felt like it was such a personal thing, and it was almost like the story of my life because I've been doing dentistry. I studied dentistry for 8 years in total. So I really, by the end of it, I felt very happy with my statement of purpose. And I also didn't allow too many people to influence it. And this is something that I tell everybody. Your SOP is yours. Like, it's extremely personal. Don't let too many people influence it. So I just showed it to a few family members and a few friends. But other than that, it was just my thoughts in it. And I also used to talk to a lot of people, fellow applicants, and people who've gotten into school. So I kind of had an idea as to what needs to go into your CV. I had almost like a checklist. So I believe my CV checked all those boxes. But a couple of unique achievements that I have, in addition to those regular things, is that I've patented an endodontic sterilization device. I have come up with a novel technique for anterior composite restorations, and I call it TWIP. And I was lucky enough to be a part of a Guinness World Record for a dental event that was held in Bangalore by My Dental Plan. So this was an event where we created a world record for the most number of people brushing simultaneously at one venue for 2 minutes, and that was 16,000 people. So my role in this event was I had to create a dental educational video of how to brush. So that video showed children the right technique of brushing. And we sent out this video much early on before the event so that everyone had learned how to brush the right way. During my BDS, ever since my first year, I had been very interested in attending a lot of conferences. So that continued even after I moved to the US. I had the opportunity to be a speaker at the ethics conference held in UW. And this was actually a very unique opportunity for me because I was applying to UW. And it actually introduced me professionally into UW. This was also the first time I met my dean. So I think that was a really nice interaction that I had with him back then. And I was also working with my mentor, the same person I used to do my bench prep practice at, um, on a space project. So we were looking at what happens to astronauts in terms of oral health when they go to space, in conditions of microgravity, and being on the ISS, or like potential missions to Moon and the Mars and all of that. So I presented that project at the ISS Research and Development Conference in Seattle. in 2023. So during this time, I also was lucky enough to build a very nice network in the US, and I think all of that added to my profile. Now, here are a few things that I think worked for me. I emphasize on this a lot, and I tell everyone who's applying, please, please, please plan ahead, right? This DDS application process or getting into residency, all of that, it takes a lot of time and it takes a lot of planning. So I started planning this back when I was in India, even before I had moved to the US. I got all my letters of recommendation, I got my transcripts from my university, all of that done even before I'd moved. And I had a rough timeline of when I'm going to be giving my INBDE, when I need to give my TOEFL, when the application cycle opens, and kind of worked backwards to figure out when I need to do things. So that really helped me stay on track and be on top of things, because I did face a few hurdles in between. But having planned it and having that buffer time really helped me tackle those. Another thing is that I looked at this as an opportunity for me to learn. For me, I always wanted to come to the US, and I was finally here. So I looked at it as a learning opportunity, and I took every single thing that was sent my way, like be it dental assisting, be it being an observer somewhere, all of that was learning for me. And I didn't look at it as something to put on my CV. So this really helped me grow beyond what I would have done if I just focused on building on my CV. And I got all these unique opportunities because of that. The other thing I did is that I reached out to people. Like unhesitatedly reached out to every single person I could. I DM'd people on Instagram. I reached out to people on LinkedIn, on Facebook, friends of friends of friends, somehow got in touch with people. And, you reach out to 10 people and one person, gets back to you and you click, that's when you find a good mentor. So that's how I found my fantastic mentors. My mentors are people who have been practicing for a while, who are faculty in different dental schools, who have just started DDS programs, and fellow aspirants. I feel like fellow aspirants were my biggest mentors because they really done their research. They really knew what they were doing, and I learned a great deal from all of them. Now, this journey was not easy. It honestly does take a toll on your mental health. It takes a lot of patience and perseverance to get through it. So I did leverage on my solid support system. I was very lucky to have a very supportive family and friend circle. When I was applying, my husband was also a student, so we weren't like very financially okay, because every application is expensive, and then you have the supplemental applications which add to the cost and all of that. So just having that really solid support system, my husband, my little sister, my family, parents, in-laws, all of that really really helped me. And what also helped me was giving them a very realistic picture of the timelines and how difficult it is to get in, because I honestly wasn't sure if I was going to make it in the first cycle. And my options after the first cycle were, to be honest, to move back to India. I wasn't too sure if I was going to continue to apply. So why UW clicked for me? I was very keen about going to a dental school, which was a part of a bigger medical system of sorts. And I saw this difference in my BDS versus MDS, because my BDS I did in Government Dental College, which was a part of Bangalore Medical College, and we had a whole healthcare system. So the kind of exposure to patients I got in GDC versus my post-graduation was very different, the type of patients that we got. So I was very keen about having that kind of exposure. So that's why UW was a great choice for me. In addition to that, I was very heavy on research and innovation. And what stood out to me in UW was they have something called CoMotion, which is CoMotion is like an innovation partner and an innovation incubation cell of sorts. So if you have an idea or a company that you want to start, they help you commercialize it from start to finish. So if you're inventing a device, they'll help you patent it and stuff like that. All of that happens through the university. So that was like a huge deal for me. The other thing is that Seattle is actually the only city I've lived in the US for a long time. Uh, so I fell in love with the city. This photo that I've put here in the background is actually from my terrace. So this mountain is Mount Rainier. It is such a beautiful, majestic mountain that's just floating in the city on a clear day. And you can also see this from the university. So it's a really beautiful city. We have three national parks very close by: Olympic, North Cascades, and Mount Rainier. We have beaches that you can enter in the summer, and you drive half an hour anywhere, north, south, east, west, and you end up on this beautiful hike. So if that's something you're into, then Seattle is a beautiful city. Um, and when I was looking at schools, I was also looking at thinking long term, I must say. I was looking at what job opportunities will I be presented with after I graduate. And I'm not talking about DSOs, because DSOs will approach you anywhere you are in the country. I'm talking about joining, good private practices, working with good practice owners for you to be an associate, to learn from, finding good mentors, all of that. And I think that's where the strong alumni network in UW really stood out to me. And yeah, so that's one of the other reasons I was very keen about UW. And although this may not be important to everyone, I must mention that UW has a really nice gym. And the nice part is that the dental school is actually really close to the IMA gym. It's a 5-minute walk. It's very nice. And because it rains a lot in Seattle, they have an indoor track. They have an indoor pool, a lot of equipment, and a lot of young people who really inspire yourself in the gym as well. And of course, it has a fantastic IDD program. So this is my cohort. We are of 10 people. I am so happy to be studying with them. Honestly, each and every person here inspires me so much. They've had such unique journeys to get into UW, and I just feel like I have so much to learn from them every single day. Really grateful to be here. So coming to the IDDS program, this is a 2.5-year program. It's a total of 10 quarters. They take 10 students per year, but I think starting this year, they're looking at taking 5 extra students. The preclinicals are for 2 quarters, that is 6 months, and the clinics are 8 quarters, which is 2 years. We do have great patient exposure and a lot of unique volunteering experiences and opportunities. A few of my classmates actually went to Jamaica this summer to volunteer for 2 weeks. And the school puts you up in this really nice resort. So you do dentistry during the day and you relax and enjoy the beaches during the evenings. So that's really nice. We also have a lot of highly accomplished faculty who are extremely friendly. So in this photo, this is Dr. Pranjipe and this is Dr. Marashi. They are actually the program directors for the IDDS program, and they're really sweet. So everyone's extremely friendly. Nobody really tells you how much they've achieved until you go on their website and you see, and you're like, oh my God, I can't believe these people are teaching me. But yeah, the program also has a lot of extracurricular opportunities. Our ASDA is pretty active. We have a lot of interest groups. I'm a part of the endo interest group. We have pros, ortho, all of that, and there are a lot of hands-on programs that they conduct. So it's really nice. And I did not honestly expect this, but the didactics and the practical training is very, very advanced. It's very good and very cutting edge, and all based off the latest research that's happening, a lot of which they conduct in UW itself. So that's a little bit about the program. A few merits is that it's a great program. You have good opportunities post-graduation, great faculty. One thing to highlight is that because of the limited class size, we're only 10 people who are integrated into an existing class of 63 people, totaling up to 73 or 74 students in a class. So we get a lot of individualized attention. The other advantage of this program is that you're integrated into the regular DDS program very early on. So we start our program in the winter quarter of D2, and you kind of just dive into it, right? It's like jumping onto a moving train of sorts. And that's when like the regular DDS people really, really helped me. At least I struggled the first 2 weeks, was a little hard for me. But they are so sweet. So you feel like very much a part of the regular class. There's honestly no difference between IDDS and regular DDS. And I think that's really unique about the program because I know a lot of programs do have separate the IDDS from the regular batch. And yeah, my personal opinion is that Seattle is a great city to live in. I love it. A couple of lookouts, and this is what I looked at when I was applying to the program. So I thought it's important for me to put it out there. This program is a longer program. So it's 2.5 years as opposed to a lot of programs which are just 2 years. And what that extra 6 months means is that you're also paying an additional 6 months tuition, which makes it, according to me, an expensive program. The other thing that really stood out to me is that it was very highly competitive in terms of the admission process. So I know we get about 1,400 to 1,500 applicants per year for those 10 seats. So it is that really scared me when I was applying. Um, Other observations that I have made is that 80% of the students of the IDDS program, they do have a master's of sorts. So this could be like a postgraduate degree or an MPH or masters in biomedical sciences, oral health, all of that. But we also have students who have not done masters and gotten in and have excellent profiles. Yeah, highly accomplished profiles, very inspiring to be honest. And I feel like everyone who are in my program do have surprisingly really good hand skills. That's something that I worked on over a couple of months, and I think that's what really worked for me. So if you're looking at applying to UW, I think it's important to get that practice in and start early. Yeah. So, a couple of messages to my fellow aspirants or anybody who's looking at going down this path. I cannot emphasize this point more, but you need to plan ahead. Any path you take, you have to plan ahead. Everything in the US works 1 or 1.5 years in advance. And, if you miss the bus, unfortunately, the next bus is coming only after a year. So a lot of things, you have to do the right things at the right time. You have to give your exams at the right time. You have to have that buffer time in case things don't go well. And just doing things at the right time, staying positive throughout really helps. And I believe that every single candidate has their own unique story. So even though this is my journey, this may not be the same as yours. Yours is extremely unique and very special to you. So it's important for you to find your own path. And my mom always says this, your destination is going to come regardless of which path you take, right? It's important to enjoy the journey that gets you to that destination. And a lot of us have received tremendous help from fellow aspirants and people who have been on the other side. So feel free to reach out, and a lot of us do want to pay it forward. So give us that opportunity to do so. I say this to every single person who reaches out to me. If I can do it, I think you can too. Uh, so good luck and thank you.
Thank you so much, Dr. Megha. It was a beautiful presentation and a lot of information. Okay. Dr. Megha, we did have one question about, is there any visa requirements while applying for the school?
Right. No, there is not. I don't think you're like at no point in my application did they even ask me what status, what my visa status was.
Okay.
So I know like a lot of people do apply on, I think I also see a question here on a B1, B2 visa.
Yeah.
You definitely can. You definitely can. As long as you have the opportunity to come here and give the bench test in person, you should be good. Visa status, having a green card, all of that does not play a role in getting into UW at all.
Okay. And there's another question on how many schools did you apply during your cycle?
Yeah, I didn't apply to too many schools. I applied to eight, which I think is not too good of a number, but I was very sure that those are the only eight schools that I was looking at. I heard back from three. The rest I did not. But UW was one of the ones that I heard back from.
Okay. And one more question we also have is ADAT required? Do we have to give it for this application?
No, they do not really look at ADAT. Of course, ADAT may or may not aid in your application, but it's not a requirement. Like I know some schools are keen about ADAT and it helps you stand out. In this, not as much, not as much.
Okay. Do
Mhm.
you have any idea what's the best score for ADAT or?
No, to be honest, I think we only had one candidate who did give ADAT because she was also considering applying to residency programs, but nobody else has given ADAT in my class. So I don't think I'm the right person to ask for the for you to have a good score. Yeah, or what a good score is.
Okay. And you did mention you had a lot of experience shadowing and assisting and stuff. So, what,
Yeah.
according to you, is like the best way to approach dental clinics to get this opportunity?
Right. I know it's not easy to get opportunities like this, especially because I was on a visa that did not allow me to be employed. So everything that I did was mainly volunteering. There is no easy way to do it. I cold called a bunch of offices, I think at least 30 or 40 offices I got in touch with. Nobody wanted an observer because you're more of like a hassle to them. You're not adding value to the practice. This practice that I started observing at, I actually just walked into their practice. And that day, the doctor happened to be there, and he was really nice because he was also an IDDS doctor who had gone through the same stuff, so he knew how hard it was.
Okay.
So he was really nice, and he that's how I got the opportunity. But every other practice that I contacted, I called, I emailed, and I called multiple times. None of them responded. So I think a really good way to actually get in touch would be through word of mouth. Like if you know someone who's in the same situation as you or who has done this before, worked as a dental assistant or done anything like that, putting a word of mouth is the best way to get in. The second way is to just turn up, like just go to the practice. There's no harm. You can't lose anything with that. And it's not easy. You do need to like really contact a lot of practices. And at least for me, that was the case. Yeah.
Okay. And how many shadowing or volunteering hours is required or best according to you while applying to these programs?
Right. In terms of my profile, I did not have the strongest volunteering hours. I feel like my CV in other aspects as compared to have volunteered, but not as much. So in terms of giving you a number, I can probably get back to you. Is that a question by Nitya? Yeah, so I can get back to you because I had a friend, one of my batchmates, who did a lot of volunteering, and that was like her strongest thing. But UW is big on volunteering. So I think where you volunteer also makes a difference. We Here in Seattle, we have something called Union Gospel Mission, which is like a homeless clinic of sorts, a dental clinic for the homeless. They have a homeless shelter, and the people who live there get dental treatment there. So if you are applying to UW and you volunteered there, that really stands out in your CV. And a lot of my batchmates did do that as well.
Okay. And we do have a question about whether you were working as a DA on a visitor visa. Would you just want to clarify on that?
Sure. So I was not working. This was just volunteering because I was on a F2 visa, which is a student dependent visa. And that does not give me any sort of work permit. So everything I was doing was actually just volunteering. But I did have a dental assisting license. So in the state of Washington, it's very easy to get that license, but it's mandatory for you to have that if you're going to be doing dental assisting. It's a very simple process. I think you can find the form on Washington State Dental Association and fill it in. And I think you just need to mail a check of $40 or something like that, and you should get your license in about 2 to 3 weeks.
Okay. We do have a couple of questions about, volunteering experience back in home country or be it in Canada. So, are those experience accepted in the application, and is it also required that you do have US experience?
Right. So the reason why people say you need to have US experience also is because I think the reviewers can't really understand to what extent you've or what kind of work you've done in your home country. It's not as relatable. Any experience that you have in your home country, like India or wherever you are, definitely helps. But for them to understand how much you've done, it helps to do it here in the US. So I would say a combination of both is important. I do know people who have gotten into schools right from India. They've done a lot of things in India. I think making it very clear, making it more understandable for the admissions team would help. But but that's why it's important to have US experience, I feel, because they can relate to it and they can understand more. And it also shows that you are very motivated to do things in this country, to understand the system and to contribute to the healthcare system.
Okay. And is there any particular master's program that has to be done or like specific to getting into programs?
Right. I don't think so. Yeah. A few of my classmates have not done a master's. That's what I mentioned. Like two of them have not. What master's does is it helps you, for example, if you don't have a good GPA, if you have something below 3.5, let's say, master's helps you like get your GPA up. It helps you publish research papers and it helps you build a network here, right? Those are, I would say, the only like reasons why I see people doing masters. I also noticed that a lot of people who did masters weren't too sure about getting into DDS directly, because DDS is like a huge commitment. There are a lot of risks also associated with it. So if you're getting into a masters to improve your profile for your DDS, I would urge you to think twice. If you're getting into a master's to actually get that master's degree, you're interested in public health, you're interested in oral health sciences, then go for it, because it's still a lot, it's very expensive at the end of the day.
Yeah. Well, we do have a couple of minutes, and I do want to say that you have been so inspiring to all of us, based on your journey and, you innovating things and, winning the Guinness World Record and everything. So, my last question is, what according to you is like the best way to craft a very good application on CAPID?
Right. I think that's a really good question, Dr. Astor, and I think it's one of the hardest ones I've found to answer. To be honest, I think just having a holistic application is great. But how do you decide what is a holistic application, right? And that's where reaching out to people really helps. Having people who are in dental schools, like freshly admitted to dental schools, review your profile helps. Another thing that I'd like to say is that I believe all of us have done such unique things. It's all about how you present it, right? We all have unique stories. And if so that's where your SOP comes into play as well, because you're reflecting upon your own journey, you're seeing how inspiring your journey has been. Another thing to add to your CV would be like schools review at least 1,000 to 1,500 applicants, right? Every school does that. Everybody is doing such a good job. Like, honestly, everyone's working so hard. But what really makes you stand out from that next person, right? So, I believe you need to have something called a wow factor, right? Two or three things that you do, that you have done, that you have achieved, or if you haven't, if you think you haven't yet done that, do it, right? Something that makes you very unique and helps you stand out, put that on your CV. Something that you think will let like leave the reviewer thinking about your application. Hey, I remember that girl had done this. So you need to have that wow factor in your CV, and identifying that and presenting that well will really help your CAPIT application stand out. In addition to that, a lot of people say, do attempts on INBDE matter? Does your TOEFL score matter? And I would say yes, because if you see at the end of CAPIT, like once you submit an application and you download the PDF, the first things that come after your personal details are your scores. So a lot of schools that receive a lot of applications like Boston and stuff like that, when those are the first screening things that they look at. So like getting those things out of the way, doing it right the first time, I feel is the right thing. Starting early, you know, reviewing it with other people as well. And like I said, that wow factor, having that wow factor in your CV can really put you at another level.
Okay. Thank you
Thank you.
so much, everyone, for joining. And thanks again, Dr. Megha, for spending your time with us and walking us through your university today. Well, I wish everybody a good week and have a great day. Bye, everybody.
So much, everyone. Thanks for joining, and thank you, Asta, for the opportunity.
Thank you so much.